Good afternoon. Thank you for joining us today for our weekly COVID-19 update. We know the focus primarily remains on interest around the vaccination administration and efforts. I think we are pleased that San Diego County is a top performer in the entire state. Our goal was to move swiftly to get as many vaccines in arms as quickly as possible. We were pleased to welcome Governor Newsom to San Diego this week to highlight the first vaccination superstation in the state of California, but more broadly than that, to highlight the fact that San Diego County again continues to be a model and a leader. We are encouraged by the speed at which we're moving. We're also encouraged by the demand for vaccine. I know in some points that causes frustration with people who want it now and they want to get vaccinated now. But I think as a county, what we are seeing is generally good in our ability to build out infrastructure, our ability to move rapidly from a vaccine received to a vaccine in arm, and certainly the public demand to get the vaccine is encouraging. Right now, the limiting factor continues to remain supply of vaccines. We could administer significantly more vaccines on a daily basis with the networks of sites that we built out, along with what other providers can do in the region. We just need the supply to kick up. We don't know. We think the next few weeks will probably be about what they've been the last week or so. But we are hopeful and optimistic that by early March we will see a significant increase and then we can move more rapidly through. Despite the supply concerns, we continue to build out our infrastructure. There's a tremendous amount of work that goes into standing up a location, identifying workforces, the scheduling component, getting all the protocols in place. And given the possibility that the supply could significantly increase within the next month, we want to make sure that we stand poised and ready to administer those. And so this week we are adding additional sites in both Vista and Del Mar to augment the rest of what we have up and running. Again, we will start doing some. It's based on supply, but we want to be prepared and ready to move forward. There have been some questions about first dose, second dose. So just to reiterate, as new vaccines come in, we honor second dose appointments first, and then with what we have left over, we open up new first dose appointments, and we will continue through that. While the superstations get a lot of the attention, we're obviously pursuing a very robust effort with a particular focus on reaching those communities hardest to reach, those underserved communities, those communities highest impacted by COVID, those that might have language barriers or lower income communities, less access to technology. And we do that through a variety of ways, both our community pods, which are embedded in the communities. They do fewer than the superstations, but they are doing vaccinations on a regular basis, along with the blocking of some of those appointments and teams of community healthcare workers who can go out and find seniors, connect them to appointments, and help facilitate their vaccination process. In addition to that, 211 continues to not only receive phone calls from seniors, but to schedule their appointments for them. And we are seeing those numbers increase and the ability to get those folks connected. If a senior who calls 211 does not have transportation, then we have transportation services available that can pick them up, transport them to the vaccine, and transport them back safely home. And we are scheduling those and doing those. For our seniors who are homebound, who cannot leave their home, even if transportation was available through our partnership with HEAL, this week we've begun going into those homes and vaccinating those seniors, again, limited to those who cannot physically leave their homes. And we are also, with our mobile teams through Operation Collaboration, some of our firefighter teams and Operation Immunization, some firefighter teams are now beginning to go into the communities to senior living centers and apartment complexes that are high propensity seniors, administering vaccines on site. All 86 of our skilled nursing facilities in San Diego County have been visited and received their first dosages at least, and 1,106 of our long-term care facilities have been visited and received at least their first dose. In addition to that, MTS is providing free rides to anyone who is going to make a vaccination appointment. So we have a variety of strategies and approaches, again, with a focus right now on administering vaccines to our seniors. And I think that it is an important point to reiterate that our seniors constitute the vast majority of COVID deaths, the overwhelming number of COVID deaths. And there is presently not enough vaccine to do everyone who is out and about to control the spread. And so the supply of vaccines we have is dedicated towards saving lives. And I think at this point of COVID, it's easy to get a little numb to the daily numbers. But yesterday we reported 51 San Diegans who died from COVID-19. Today we are reporting an additional 51 San Diegans who died from COVID-19. This is just over 100 of our fellow San Diegans who lost their life that have been reported in the last 48 hours. Out of these, 83 of them were senior citizens. And if we pause for a moment and think about if 83 people had died from some external or new thing in the last 2 days, we would do everything in our power to try and address it and stop it. These are not insignificant numbers in terms of loss of life. And we have something that can significantly stop it. That's the vaccine. And the vaccine getting in the arm of a senior can save their life. And that is why our focus presently is on senior citizens and will remain on senior citizens until every senior has been offered the opportunity to get a vaccine. Then we will be able to move on to that first tier of essential workers, that being teachers, educators, law enforcement, and food and agricultural workers. And we want to get there, and we want to get there as quickly as possible. But we have to make sure, again, that the vaccine has been offered to seniors. We don't know supply, and we don't know how many seniors will want to come to one of our sites and take it. I know Orange County and Los Angeles have said they think they'll get to that first group of essential workers in the next 2 to 3 weeks, and I would say we're on a similar trajectory, probably at latest 2 to 3 weeks away from being able to move into those tiers. But we are working to prepare for that. We're working to build out and have ready to go dedicated vaccination sites. We've been working with the County Office of Education and with VIBA to build out dedicated sites for teachers and school personnel when we get to that phase, to be able to have additional sites that they can go to focused on vaccinating them. With the vaccines going to schools who are open or who have a signed agreement to open pending administration of a vaccine. And I know a lot of schools are working on putting those packages together. We want to do it with an equity lens in mind and making sure we're hitting hardest served communities. But at our teacher and school personnel sites, those will be prioritized for schools that have an agreement to reopen pending vaccination or those schools that are already open. We're working with Scripps Health on dedicated sites for law enforcement personnel so that they can get in and get vaccinated when we open that, and we're going to have a particular focus particularly on those law enforcement personnel who work in our jails and those who work with high-risk populations such as homeless to make sure that they can get it and everyone else. And we're working with our grocery workers and grocery stores, again, to build out dedicated capacity for them. And then finally, our CAL FIRE teams that have been going out to long-term care and skilled nursing facilities, those will be ready to go into the fields to make sure we're taking care of our farm workers, again, some of the most vulnerable. And so we are not at the phase of this grouping of essential workers, but we are working tirelessly to prepare for that. And again, moving into that phase is predicated on supply, and we hope to see that increase, and we will keep doing everything we can to move rapidly through these tiers and get as many people vaccinated as quickly as possible. With that, let's jump into our slides for today. You'll start here with our dashboard. What we're showing here, the 651,450 is the total doses that have been received into the region. This is what has physically shown up in San Diego County. Out of this number, 550,707 have been administered, a mix of first and second dosages, but that's what has been put into arms. We know of 8,155 vaccines that have been administered. They're just pending the upload into the system. And we have 92,588 doses to be administered. These are upcoming appointments. Now, if you add up those bottom numbers, it is more than the top number, but we do know and are hopeful that additional vaccines have been shipped but not received. And again, we'll continue to work to limit new appointments to vaccines we're confident that we have. And then you can see on the right-hand side, 15.5% of our adult population have received at least a first dose, and 3.3% are fully vaccinated. They have received both first and second dosages. Next slide. Here you just see the map. Again, this is the network that is being built out. The stars representing those super stations, most capable if you have supply of doing up to 5,000 or a few even a little bit more per day, but again, very limited on supply. You see the new superstation coming in North Coastal. And then the triangles representing our community pods, points of distribution, again, embedded in the community, harder to reach folks, a lot of targeted efforts around getting people plugged into those. And we think this network is robust and can certainly do exponentially more vaccines than we're doing now. We're just waiting on supply. As it relates to cases, you'll see here we had 3 days in a row under 1,000. Encouraging today, a little bit over 1,000. Again, it's not the day-to-day number, it's the overall trends. And again, the overall trends are generally positive. You see that purple line, our 14-day percentage of positive, again, continuing to trend down. We will have to see where this goes, but we are hopeful that people continue to understand the actions that brought our case counts down are the actions we need to continue our case counts going down. And with the presence of new, more contagious strains, we don't want folks to relax their posture around taking action to slow the spread. Again, generally good trends in hospitalizations. On the next slide you see here, our COVID-related hospitalizations, again, continue trending down, not as rapidly as cases, but that makes sense because of the lag. But both COVID hospitalizations and COVID ICU utilization, again, headed in the right direction. On the next one, you'll see the total ICU system. We've talked about this a great deal. As the number of COVID-related ICUs shrinks, the non-COVID ones will increase. Our healthcare systems are catching up a backlog of deferred procedures. So that staffed and immediately available number of beds probably will not fluctuate much for quite some time. And then this last one here, second to last one, is just a reminder to us all that COVID continues to be deadly. Yesterday we reported 51 fatalities as a result of COVID. Today we are also reporting 51. And again, out of these 102, 83 of them were senior citizens, which again reinforces and reminds us why we continue to focus on vaccinating seniors today. And then final chart just shows where we are on the path descending to a lower tier. You can see it wasn't that long ago. Our unadjusted case rate was almost at 100 at 97. We have now cut that by 2/3 down to 35. But we need San Diegans to help us. We need San Diegans to continue to take action to lower the spread. Getting in lower tiers obviously means more of our businesses that can be open, greater ease for our schools to get open, more youth sports, and lower spread, of course, means lower hospitalizations and less deaths. But we're generally encouraged by the trend for where we're headed, and we hope to keep it going that way. With that, let me turn it over to Vice Chair Vargas for her update, and then both Dr. Wooten and Dr. McDonald are here for your questions.